Hey, Dr. Kevin, EP True Chiropractic, in the office this morning, doing some physicals on the athletes coming up for this coming school year, so they can get that done and out of the way. Don't Parents don't have to worry about that. But also had a little time. Printed out some studies on low back pain and headaches. All right, two of the most common things that we see in the office, and debilitating uh, symptoms that can happen to patients around the country, around the world. And it's very, very interesting that we'll talk about low back pain first, with a veteran study, and then opioid versus chiropractic study. So, Journal of Alternative and Complementary Medicine. And it's funny, it talks about most people go to the doctor's medical model first, all right? But the opioid analgesia, so opioids, when they get prescribed for opioids for severe low back pain, 55% less opioids are prescribed to people that are under chiropractic care. 55%. So why don't the doctors say, go conservative first, go to um, chiropractic care first versus getting the drugs right away? It's 55% difference. And then yeah, just crazy. 55% difference. So people are getting addicted to opioids because of these having low back pain and headaches. But man, they wouldn't have to get addicted if they weren't prescribed them. That's a crazy thing. And then another study in the veterans. So this is a veteran study in the VA system. 5.7 million patients served annually in the VA, Department of Veterans Affairs, and over half have chronic low back pain. So that's millions, 2.5 million, or over that, almost 3 million people, chronic low back pain. Over half. And this one was all about chiropractic, and they're really trying to incorporate chiropractic into the VA, which is great. But what they do, I think, that just practicing for 20 years, they said they give them 6 visits over 3 weeks to get rid of chronic low back pain. I'm sorry, but just clinically, it's going to take longer than 3 weeks and more than 6 visits to get that chronic low back pain, even to get into a maintenance phase. So I think it's good we're getting chiropractic into the VA. It's a great start, but they need more care. They serve our country, they serve us. We need to give them the right care and the appropriate care so that they can get well. Then the last one that I want to talk about is the headache study. And this one is really interesting on headaches in North Carolina. A large study, 660,000 people in North Carolina that they did the study on. And some of the stats that they came, $1 billion among migraine sufferers. So, and it costs employers $13 billion in this just North Carolina, that being out of work when people get their migraines. The direct cost burden of migraine as being substantially higher, so they think that's even a lower number. Yeah, it's crazy. Just prescription drugs, 4.6 billion on prescription drugs. 5.2 billion on outpatient costs, half a billion to emergency room, almost $1 billion in inpatient costs. So just crazy. $7,000 yearly for a patient with migraine, compared to $4,400 without migraine, almost close to double there. So huge costs for headache sufferers. That's common. But the crazy thing is, at the end, the conclusions of this study, that most people go to medical first, which is more expensive. And it says the expense patterns, the the cost going to the chiropractor first is significantly lower than the MD only care, but everybody goes to the medical doctor first. So why wouldn't insurance companies, why wouldn't states, why wouldn't people be educating people, like, go conservative first, get the care there, see how much it reduces or goes away, and then at that point, if you need medication, then go to the doctor. So the studies are there. It just doesn't make sense why that's happening, but you can draw your own conclusions on why they go to the medical doctor first. All right, thought you'd enjoy that.